Welcome, everyone. Thank you so much for joining us. I'm Aarti Sharma. I'm the board chair for the Feminist Center in Atlanta. During this briefing, we'll be discussing what it looks like to provide abortion care in a restricted access state, the connection that that has to broader systems level work, and the role funders play in supporting this work. Independent clinics are key players in providing essential care, pushing proactive policies to expand access, and by being plaintiffs in court cases challenging draconian abortion laws. We'll be talking about the Feminist Center's work and the impact independent clinics have on access in a state like Georgia, which has a 6-week abortion ban. You'll also hear from Abortion Care Network and Amplify Georgia Collaborative. These are organizations steeped in abortion access work regionally and nationwide. They bring a bigger picture view of the role feminists plays as an independent clinic in the abortion access movement. We'll also be talking about how Feminist Center and advocates are organizing beyond this moment to expand access and the role funders play in fueling that change. Before we get started, I'd like to introduce MK, who will be our moderator for this event. MK is going to point out some tech features throughout this webinar. MK?
Thanks so much. And thanks for everybody for introducing yourselves and bearing with us with the disabled chat. I just wanted to point out a few tech features. And again, my name is MK Anderson. I'm the Director of Development and Communications with Feminist Center. And I'm very excited for y'all to be here today. So I wanted to point out a few tech features. So first, there is the option to enable captions. If you go to the bottom of your screen, there should be a little CC box, and it should say captions next to it. Next, we do accept anonymous questions if you have them. You can submit your question by clicking on the Q&A box, also at the bottom of your screen. And we'll be incorporating those questions throughout the session. And if you have any technical difficulties or feedback for us to help make sure that you're able to participate in the webinar, please direct that to Clover, who is our donor relations manager, and they'll work with you to make the webinar more accessible. All right, I'm going to turn it back over to you, Aarti.
Thank you so much. I have the pleasure of introducing Kwajalein Jackson, who is our ED at the Feminist Center. She has been with the center for over 10 years, and it is my absolute pleasure and joy working with her as board chair. She has led the expansion of feminist statewide and national impact, including deepening our community partnerships, leading the organization's civic engagement, advocacy, education, and outreach. She's become the organization's first Black woman executive director. Kwajalein has been named one of the 500 most powerful leaders in Atlanta by Atlanta Magazine for 5 consecutive years. She's been recognized internationally, nationally, and locally for her work in this sector, mostly for her depth of knowledge, her passion, and empathy on women's healthcare, specifically abortion access. Personally, I'm always struck and inspired by Kwajalein's calm, steady, and empathetic leadership in the face of constant change and a constant attack on our fundamental rights. It is my pleasure to introduce Kwajalein.
Thank you so much, Aarti, and thank you so much to everyone for joining us this morning or this afternoon, depending on what part of the country you find yourself today. I am incredibly proud to serve as the Executive Director for Feminist Women's Health Center, who's been providing compassionate abortion care in the South since 1976. We are dedicated to the full spectrum of reproductive justice. So we consider ourselves a reproductive health, rights, and justice organization, and do that work through multiple components of our care. Many people know us for our clinical services. We provide both medication and procedural abortion care up to the legal limit in Georgia. which before 2022 was well into the second trimester. But now, since the decision to uphold Dobbs and overturn Roe versus Wade, we have been restricted to only provide abortion care up to the point at which fetal cardiac activity is detectable. But we are more than a clinic. It's incredibly important for the people who are engaged with us to understand that while we are working to support the reproductive health care needs of all of the people who need our care in Georgia and in the surrounding states, that we are also working tirelessly to make sure that our rights, resources are protected through legal work at the state capitol, through advocacy at the state and national level, and through organizing in the community. Alongside that, we do deep sexual and reproductive health education programs in our community in both English and Spanish to make sure that people have all the information and tools necessary to control their reproductive freedoms. And as was mentioned, we have served multiple times as plaintiffs to fight against restrictive laws that have passed in our state, including the 6-week ban, in our partnership with legal entities to make sure that we are battling not only in the Capitol, but also in the courts. We are a multiracial, multi-generational, independent, feminist, Black-led organization that is dedicated to this work and is committed to being here for not only the past 50 years, but for the next 50 years. Part of what we wanted to talk about today was to share with people what has kept us going and what we have been facing over the 2 years since the 6-week ban went into effect in Georgia. As I stated, before the 6-week ban went into effect, Georgians were able to access abortion care up to 22 weeks from the last menstrual cycle. But in July of 2022, the 6-week ban was allowed to go into effect. And at that point, we were no longer able to offer abortion care beyond the point at which fetal cardiac is detectable via ultrasound, meaning that hundreds, if not thousands of our patients were turned away from care. It means that people in Georgia and in many surrounding states in the Southeast, as well as in the Midwest, were forced to travel hundreds, if not thousands of miles in order to access care that they should have every legal right to access when they need it. It's always been difficult to access abortion care in the United States. We have seen over the course of multiple Supreme Court decisions, those rights eroded and chipped away because of state legislatures, because of anti-abortion extremists, because of shifts in funding and regulation, because of the difficulty in keeping clinics open and thriving in such a hostile environment. But I am pleased to say that in spite of these restrictions, in spite of the ways that abortion has been attempted to be erased in this country, we were still able in 2023 to provide more than 2,500 abortions for people not only in Georgia, but in Alabama, Tennessee, Texas, Oklahoma, and many other parts of the country where it is no longer available. We continue to fight not only to offer this care in our clinic, but also in the state capitol to expand access, to not only restore what was taken, but to go beyond, to make sure that the people in our communities have exactly what they need, not just abortion care, but comprehensive reproductive health care, gender affirming care, and protection during pregnancy and birth. You'll hear more from our colleagues at Amplify Georgia about the Reproductive Freedom Act that we have worked very hard to move forward in our state legislature. But I also want to bring to folks' attention how difficult it has been to continue to offer the care that we have been known for almost 50 years. Because of the rising cost of providing that care, because we are committed to making sure that our staff, Our leadership, our providers are compensated fairly and in keeping with our values, because the costs of medical equipment, medication, and other tools that are necessary for providing clinical care are necessary, and those costs continue to increase. Because we have been committed to keeping the price of abortion low for our patients so that they will spend almost nothing out of pocket, because so many of our patients are uninsured or underinsured or unable to use the coverage that they have for abortion services, we find ourselves with a significant gap in our funding. The graphic you see on our slide deck reflects how much it costs us as an organization per procedure, while we keep prices at $575 or below for all of our patients. We know that people who don't have steady or secure income, people who are living at or below poverty, deserve to have compassionate, high quality, impeccable healthcare. And so we are willing to subsidize and use sliding scale to make sure that people are not denied access to care they need because they can't afford it. But that means that the support of our community, our donors, our funders, the people who are committed to this work, help to make this possible for so many folks. We are so grateful to our community that has allowed for us to keep our doors open, to keep our staff employed, and to keep providing the compassionate care that we are known for, in spite of all of the attempts that come to keep us from being able to offer that care. Again, I'm grateful for the ways that we have been able to survive up to this point, and we know that this is only the beginning of what we would like to be able to offer to the communities that we serve. We're working actively to expand our services so that we can better reflect reproductive justice in our clinical care. We want to make sure that people, not only those who want to terminate a pregnancy, but also those who are interested in growing their families, have access to resources and support. We want to make sure that gender affirming care is available to people across the gender spectrum, where they live, and with dignity. And so I'm really grateful that we have this opportunity to answer your questions and to give you more insight into the ways that we are expanding the fullness of reproductive justice in our work. I'd like to next introduce Nikki Madsen, who is the co-executive director of the Abortion Care Network, a membership organization that helps to support independent clinics across the country and our allies. Thank you.
Hi, everyone. I'm so happy to be here today to lift up the work of independent providers like Feminist Women's Health Clinic and the many other independent providers who are in the same situation as Feminist across the country today. So I don't think I have access to the slides. So if someone could move it to the next slide, that would be great. Thank you. Since Roe, independent clinics have provided the majority of abortion care in this country. And every year, ACN produces a comprehensive report on the state of abortion access across the country. That report is called Communities Need Clinics. And I know someone on the Feminist staff is going to throw that link, the full link of the report, into the chat for everyone. So when you have a moment later on tonight, you can take a more in-depth look at the role of independent clinics in the landscape of abortion care. But I wanted to highlight two really important graphics today. First, the one on the left shows that in 2023, independent clinics continue to do the majority of abortions in this country, providing 55% of all abortion care at indie sites. And the graphic on the right is really one of the key pieces about why independent providers truly are invaluable in the abortion ecosystem is that they are providing the vast majority of care as pregnancy progresses, including all of the clinic-based abortion care in the United States past 26 weeks. Next slide, please. So the graphic on the left here is from the New York Times, and you can see that independent clinics, or what I should say is this is a graphic of bans, states with abortion bans, from a total ban, which 14 states are in a total ban right now, to all the way up to an 18-week ban. And what is really important to know is that independent clinics have been providing care in the most hostile states in the country for abortion access, including states like Georgia. So given that these clinics are providing the majority of the care in the United States, that they're operating in the most hostile states, and they're providing the vast majority of care as pregnancy progresses, independent clinics like Feminist have been disproportionately impacted by the Dobbs decision. Yet they have seen the same level of, yet they haven't seen the same level of foundation and individual donor support that we've seen to national organizations. Sadly, the lack of financial support provided to indies, compounded by the political tax, have really reduced the number of independent clinics in the United States significantly. Since Dobbs, we've lost 65 clinics. They've either been forced to close or stop providing abortion care, leaving people with fewer options, particularly in hostile states. And since 2018, 1 out of every 3 indie clinics have closed in the United States. You'll see the little heart graphics at the bottom with numbers in it. There are currently, or those heart graphics currently represent 72 indie clinics remaining in the states with bans. You can see that almost over half of them, or I put in there 36 of them, exactly half of them, are currently in Florida, relying on November's ballot measure to keep their clinics open. Feminist is just one of 12 remaining clinics located in a state with a 6-week ban. And all 72 of these clinics are very vulnerable to closure and are essential to keep open. Next slide, please. So why are they so essential to keep open? Not only are they just wonderful places to receive care, but really important things that happen are lost in communities when these clinics close. Community-based, when we lose a clinic, we really lose community-based medical expertise and local clinic staff that provide care and respect. Because independent providers are rooted in their communities, they are best equipped to gauge and respond to the needs of their communities. When we lose a clinic, we lose legal standing. Independent clinics can and have served as plaintiffs in legal challenges, blocking bans, overturning harmful laws, winning SCOTUS cases, and we need them to restore abortion access in their states. When clinics close entirely, they lose standing and can no longer bring such lawsuits. We lose critical care. Indies like Feminists continue to give people the abortion care they need within the law and help people to navigate care out of state when they are unable to provide that care. And we lose trusted healthcare clinics for people that are uninsured or underinsured. Indies may be their only source of healthcare or the only healthcare provider people trust to treat them with dignity and respect. Next slide, please. So, why Feminist? I mean, in addition to all those other reasons that Feminist is just the best clinic and all the reasons we really need them to stay open, is that Feminist is a leader in integrating reproductive justice practices into clinical care. And not only do they lead, but they actively share those learnings and work to support other clinics in our network on that journey. Their staff also lends their expertise to boards, conferences, and convenings, and is actively educating the public. From some of you may have seen, from Christy Teigen's couch to the United Nations. Feminist Women's Health Center's work is critical on educating our leaders and the public on the realities people in need of abortion care face and what is necessary to create the change we seek in the United States and beyond. Feminist Women's Health Care Center is a pivotal voice in envisioning for the future and an actor in bringing their values to the community every single day. To help correct, and actually go down one more for the slide, thanks. To help correct the historic underrepresentation from philanthropy and the public to independent clinics, Abortion Care Network launched the Keep Our Clinics campaign in 2020. After Dobbs, Abortion Care Network committed to a 50-state strategy to support independent clinics, whether they were in banned states or states with more access to care. Because when it comes to our human rights, we cannot leave anyone behind. Between 2022 and 2023, we're proud to say we raised and granted out $8 million to independent clinics. 44% of those funds went to clinics in states with bans. The work feminists and all clinics in these banned states are doing is essential for the long-term vision of abortion care and building back abortion access in states, and we are proud supporters of these clinics, but we really cannot do it alone. I want to say that I am also personally a monthly sustainer to Feminist Women's Healthcare Center because they are a beacon of hope. The reality is, and it hurts my soul to say this aloud, but the reality is that things could get much worse before they get better. And when it comes to abortion access in the United States, and Feminist leads the way, showing us what resilience looks like by supporting the community while working toward a liberated future for abortion access. That is the type of care and leadership our world needs as we navigate whatever comes next. I hope you feel inspired today and join me in making a gift to feminists, because we need them around tomorrow, next year, and for generations to come to realize the vision of abortion access and liberation we all know is possible. I'm going to hand it back to you, Kwajalein.
Thank you so much, Nikki. And I would be remiss if I didn't share that I am also a proud member of the board of directors for the Abortion Care Network, which does such incredible work to make sure that independent abortion providers are cared for, are in community, and are supported for the long term. Now it's my pleasure to introduce Rula Abisamra, who is serving as the interim executive director of the Amplify Georgia Collaborative during the parental leave of their longstanding executive director, Allison Kaufman. Thank you so much for joining us today, Rula.
Thank you, Kwajalein. Hi, everyone. That's right. I am normally the state campaign director at the Amplify Georgia Collaborative, and it's an honor to be here with you all, with the Abortion Care Network, and to get to share just how much the Feminist Women's Health Center means to me and to us and to our work. If I'm having any connectivity issues, flag it for me before I go too far into a sentence. So I will just share really briefly. Amplify Georgia's theory of change is that we cannot do anything on our that is going to be better than we can do together. We will go together. I have always believed resources, assets, power, and creativity of folks of color in Georgia. And where I came from in this work is, in fact, having worked at the Feminist Women's Health Center as well, first in the world. And providing care for people who were seeking an abortion. While it wasn't what I specifically went into the job to do, you know, I had like a general interest and devotion to the field and the idea of being there for folks when they need it. It really was so tremendously eye-opening that people don't show up for folks who need abortions. And if that's the case, I felt I really was going to have to do it. And so were those of us who were here in this clinic, the people at my left and my right. We were showing up for the folks who needed abortions. And ever since then, I've wanted to show up for the people who show up. And one thing about the work that we do, first of all, you know, there's a tension between wanting to show up for people who they need something now, going through it now. They're in the gap and we are standing in the gap with them to the extent that we can, because the situation is hard and it's always been hard. But it wasn't that way by default or by nature. It's in fact made that way by people who have never been or will never have to be in the position of needing an abortion and going through the very same hoops and hurdles that they have passed in legislation. So every time I would be there, you know, ready to support folks in my day, dozens and dozens of times in a day, you would see folks have the same kinds of barriers and obstacles and frustrations, or, you know, falling short of getting their care at the last minute, not because of a personal failing, not because of plain bad luck. A lot of bad luck is actually systemically manufactured. And, you know, we would see these patterns and it kind of drove me nuts. And I said, as much as I love doing the job, using my hands and my heart and my feet every day, I need to see myself also like trying to see us through to some place on the other side of this. There's so many, right? So many barriers and systemic bridges that I was like, we got to cross this. It doesn't have to be this way. And so my career has taken me a few different places, but always sort of like circling back to where I started and why. And it's been a dream to work in the Amplify Georgia Collaborative and to build this collaborative because we knew we wanted to focus our work around campaigns for policy change and culture change in Georgia. And in fact, where we began was with the theory that starting in our cities and counties was an area of strategy that our movement had not paid a lot of attention to yet. And we've had some really amazing early successes, such as getting Atlanta, the city of Atlanta, to be the first city in the Southeast to fund abortion. And I think the 6th nationwide. So funding abortion access through City of Atlanta dollars. That's something we continue to work on and attempt to expand. And more recently, the state campaign for the Reproductive Freedom Act. And I'll talk about that a little bit more in a minute. But before I get too much farther, if you could go to the next slide, please. The Amplify Georgia Collaborative is a collaborative of now 9 reproductive health, rights, and justice organizations, really focused around the reproductive justice leaders, the Black and Brown-led people of color centering organizations that are community-based, whether that's through service and like health services or through organizing. The 4 organizations at the core, the founding of Amplify, include the Feminist Women's Health Center. And if it hadn't been for those 4 organizations having a history already of working together, of being in this space, of having relationships from the collaboration that is often required when we are doing rapid response to the things that are hard, the things that threaten to make things worse in this state, if it hadn't been for that history, I don't believe that the long-term what we were able to create would have successfully arisen out of nowhere. And so what Amplify does is never without our partners. We convene our member organizations, our allies, and other partners around shared agendas and campaigns, which are partners with us doing capacity strengthening, connectivity, the kind of glue between partners. But if our partners aren't leading, something's not quite right. And we're powered by the leadership of the Amplify partners. And so it's again, like it's really cool to me to be able to support what Feminist is trying to, the importance of the care in the community, I want to talk about how that care and expertise leads to a way of showing up for the systems change work that be like replaced one for one by like, there could be another advocate, there could be a different advocacy organization. The kind of care that Feminist provides, yes, the fact that there's abortion care in mission and their practice for decades, but also like way that they provide that I learned abortion care can and should be provided, I think says a lot about how about their approach to movement building and their approach to the change that we want to see in the world, like being written down on paper and move forward as proposals. Go to the next slide, please. This is all of us, or a fraction of all of us at the first introduction of the Reproductive Freedom Act in Georgia. That's House Bill 75 and Senate Bill 15. They were first introduced in 2023. We have a 2-year of legislative sessions in our state, and so you can expect to be back again in 2025. This was the very first time that a bill like ours was introduced. What was really beautiful about this is it's one bill that is not a message bill. It's actually, if we were to have real access for everyone in Georgia to an abortion when they decide they need it, this is what it would look like. In Georgia, many people are now aware that we have a very restrictive 6-week or so abortion ban. I think that before 2022 and before 2019, when that ban was passed, many fewer people were aware of all of the restrictions that already existed, the barriers that both hidden, embedded and on paper as laws that prevented people in care, and especially disproportionately impacted the folks who are trying to make and have low incomes or don't have health insurance, or they have Medicaid and therefore are cut out of getting support for coverage for abortion, are young, people who are immigrants, and in general, we have been living under all of these like little cuts and nicks for so long, and providers like the Feminist Center have been stretching themselves to try and, okay, we'll do more paperwork. Okay, we'll add some staff people to make sure that the lines are staffed longer. That way your 24-hour delay is not going to turn into 48 hours just because we weren't on the phones that day. Stretching themselves so that people could still get care. But a lot of these things that they start taking the shape of, it's more paperwork at the clinic. People just thought this is how medical care has to be provided. This is healthcare, and it's really, really not. And so someone at the Feminist Women's Health Center, the policy and advocacy manager, who in 2018 had done a lot of research on all of the different restrictions that are in the code in Georgia, in our legal code. And by the way, many of them are in the criminal code. So from decades, we have been dealing with abortion not being treated as something that you can regulate under the public health code like other health services, but instead many of these are showing up in the criminal code with criminal penalties. And so that colleague said, if we could really transform the framework under which we look at abortion care and really treat it like care, here's the laundry list of provisions, current pieces of law that would have to change. And it's actually, we can package it. We can put it in a bill. Then people can see that it's not so hard to make changes to how things are done. It's actually a lack of political will. And so you can go forward a little bit in the slides. So that political will is something that we are still building. And what I wanted to say about the Reproductive Freedom Act is that the research and vision that began that campaign, this whole bill, came from the Feminist Women's Health Center. It came from what it takes to provide abortion care in a state that is restricted like ours, and with particular knowledge of the restrictions that we have in Georgia. You can't do that if you are only doing the research out of books. You've got to be in communication with your providers on one side, your community on the other side, which is something that Feminist has always been really brilliantly great at. And so that expertise, as I said, it leads to vision and credibility that are really grounded. The continuing expertise shows up. Feminist educates lawmakers. We do work together on other issues for rapid response, and they educate through the media as well. As I said, the piece around relationships and history and trust, these are pieces of the movement that they connect us all. You can't replace them quickly when they're gone. You can't build them up quickly with a bunch of fuel. It takes time. And yeah, it takes time, and it takes real, genuine leaders. And finally, the gifts that Feminist Center gives to the movement is in shaping leaders who go on and continue in this movement in our state and elsewhere. That's the programs staff doing their leadership in our campaigns and on our steering committee. They train other advocates, other colleagues that we have in their legislative advocacy workshop. They train fellows, health promoters in the community, and clinic staff like I was, and volunteer patient escorts, people who now know what it is like day to day to have a community center that is trying to support people getting care. And those people are coming from all over Georgia, all over the South, and they have different contexts. They're all different people, and we don't need one size fits all rules that will shape and decide how their lives will come out. And
Okay, so I think that Rula might be having some technical
Really
difficulties.
there's so much in our community and movement. Thank you.
Thank you, Rula. Thank you so much. I think you might have cut out a little bit at the end there, but really appreciate all of your
Oh, so sorry.
expertise. No worries at all. Thank you so much. You just bring such passion to the work. Thank you. So now we're going to move on to some questions, and thank you so much for your engagement in the chat and also in the Q&A box. We do have a few questions that we are going to get to today. So one that we have from Rebecca is, what is your biggest financial need at this time? I think maybe this is one for Kwachila.
Yeah, I'm happy to answer that. So in spite of what I shared earlier about how our abortion volume only decreased by about 20%, we still saw an over $600,000 loss in 2023. And because of that, we have had to tap into our reserves. We have had to take on additional debt. And we have been working really tirelessly to increase our donations and contributions. Right now, based on our projections for year-end 2024, we anticipate that we are still at about a $250,000 deficit in our budget. So we are working hard, of course, as I mentioned, to add additional clinical services that we think will bring in some additional revenue, but general operating support that allows for us to continue to pay our staff on time, to make sure that our facility and equipment are up to date and functioning appropriately. That is the place where our fundraising need is the greatest. We have been really fortunate to be able to access grant support for our programming, some of the legislative advocacy work that Rula was describing, our outreach work through our promotoras and our Lifting Latinx Voices initiative, our civic engagement work. All of those programs have been very well supported, but our ability to continue to provide high quality clinical care is the place where we are having the most difficulty raising support. We're grateful that places like Keep Our Clinics at the Abortion Care Network stand in the gap and make sure that independent clinics have access to funding, as well as resources for abortion delivery, but we still need additional support to make that gap close.
Thank you, Kwachila, for that clarification. So we have another from David. In addition to voting and donating, please let us know what else we can do to help. I'm a husband and father of an 8-month-old boy. I want him to grow up in a family who knows how to support and respect their neighbors. I think this might be a group question.
I'm happy to jump in first and then pass it along. One of the things, there's a couple things that come to mind to me is that really raising awareness of independent providers broadly and how important they are to the abortion ecosystem. Most people don't know their local independent provider. And so it's just really critical that people that are innovating, that people are protecting abortion access, that people are really doing the work, are recognized for that work that they're doing, and that people learn more about these clinics. And I think another thing is, no matter where you live, I saw someone say, like, in the chat, like, I'm in Seattle, but I was born in Georgia. No matter where you live, you should figure out who the independent providers are in your communities, know them by name, help people who may need access to care, know how to get care. And really, many of the independent providers in the nation provide lots of different reproductive health, gender affirming, and other types of care. Utilize those clinics for the care you need to. And that is one revenue source that will help these clinics stay sustainable if you use them for your care as well.
I think I would just add, in addition to financially supporting organizations that are working towards expanding abortion access, having everyday conversations with people in your life around not just abortion care, but around sex and pregnancy and all of the different ways that our healthcare is often stigmatized. If we can normalize those kinds of conversations, particularly with young people, if we can start to demystify sex education, we can continue to make this an important part of the way that we live our lives. I think that that will do a tremendous amount for the next generation's comfort and acceptance and value on reproductive justice. We can make sure that it is not an afterthought, but it is a normalized part of the way that we live and work together.
Thank you so much for that. Such a rich conversation. All right, so we had another question in the chat, and I answered it briefly, but I think there's a lot of meat there, so I want to raise it again. So this is a question from Rachel. What levels are y'all advocating on these days? City, state, federal, county? And I mentioned we're very much locally based. We do a little bit of federal, but Kwajalein and Rula, I'm wondering if you could speak to the different levels of these advocacy campaigns and how they relate to the broader picture and vision for reproductive justice.
I'm happy to start, and then I will pass to Rula to add. So most of our advocacy and organizing work has been focused on the state legislature for a very long time, in part because a lot of restrictions and policies that affect reproductive justice are decided there, and they have far-reaching implications. It's important for folks to recall that many of the cases that have traveled up to the Supreme Court were born in state legislatures. But in addition to that, over the past several years, we have focused more attention, in part through our partnership with the Amplify Georgia Collaborative, on county and city level efforts. So one great accomplishment has been the establishing of a reproductive justice commission at the city council. That was several years in the making and was a collaborative effort that Feminist Center participated in. In addition, we've been working to establish abortion funding at city and county level governments to help to support ARC Southeast, or Access Reproductive Care Southeast, a local abortion fund that not only supports people who are accessing care in Georgia, but across 6 states in the Southeast, people who are traveling from those states or to those states, having access to funding that would help cover the cost of their care, but also practical support around their rides, their lodging, their childcare, and other expenses that come up as people are seeking reproductive health care. And so having state and not state, unfortunately, but having city and county funding dedicated to making sure that Georgians who are seeking abortion care have access to resources that would support their ability to travel for care if they need it, or to access care in state if they need it, has been a very important effort that we've done in partnership with the Amplify Georgia Collaborative. Anything you want to add, Rula?
I would say that the work for our county and city level change is ongoing. There's 159 counties in Georgia, and we have a strong base in the counties in Metro Atlanta, and we will connect across the state who are wanting to be part of this movement or already are part of this movement. This year we did support fellows in Athens, Macon, and Savannah for the first time. We've never had a sort of training fellowship before, and it was a pilot, and we are evaluating it. We'll see if it makes sense to continue. But the hope here is that we continue connecting all over the state of Georgia, who, again, are folks who Feminist serves folks all over the state of Georgia, and traditionally, and still somewhat today, like all over the Southeast, people like working on an abortion funding hotline, which I also did. You really see the distances people travel to get care, and sometimes Atlanta was the place people were coming to get care. That was one of the things I always wished people understood when I was trying to find Georgia access hub for many people in this kind of red region. And we have suffered some real setbacks, and we're still trying to hold line with our partners. And Feminist is like a key, clear example, as I hope we're conveying here. But you can see we're working in concert, the abortion fund and the abortion clinic and the collaborative, trying to move policy change. We know that as important as it is, and as much as like grassroots funding means so much to me, when people in our community give dollars to abortion access for it to directly support their neighbors. We also know that the Commonwealth has to support this like it matters as part of the fabric of people's lives. And so that's why the Reproductive Justice Commission, it's like a voice in city council, the ability to get this funding, and to also say, to the extent that cities and counties can, take their hands off of intervening, investigating, and criminalizing people because of these laws. We're also advocating for that with Feminist and other partners. So the work continues. Call us if you live in DeKalb County and want to be part of it. Yeah, it keeps going. It keeps going and going. Thanks.
Thank you for that. That's one of the things I love about Feminist Center and Amplify. We're really kind of hitting all of the different levels of government, and that kind of multifaceted strategy is so important when you're talking about systems change. And so many folks don't know, what does my city commissioner have power over, or my county commissioner? And the city has funds for abortion. How does that work? So that's such an incredible dynamic, especially with Amplify and Feminist. So we have time for one more question. And
we had a great question in the Q&A box. I don't know if you want to circle back to that one.
Yes. So we have a great question here in the Q&A. So Hari asks, you saw a 20% decrease in patients, but noted that we did see an influx from the surrounding states with more restrictive rules, Alabama, Tennessee. How much has the 6-week ban in Georgia impacted Georgia residents? My guess that it's higher than 20%. As always, great work.
So I was able to type a little bit of this in the answer box, but I'd love to expand upon it out loud for the benefit of everyone. I think one of the things that has been somewhat surprising, but has been in keeping with what we've seen in other states, is that even when there are restrictions that come against abortion care, it does not stop people from seeking abortion. And what we've seen nationally is that actually abortions have increased over the course of the time since Roe has been overturned. For us, our ratio of in-state abortion care and out-of-state patients has remained about the same. So about 15% of our patients travel to Georgia for care. But we've seen that the highest volume of patients are coming from 3 states: Alabama, Tennessee, and Mississippi. That probably comes as no surprise because those are very proximate states to us. Those are states that even before the 6-week ban went into effect and before the Dobbs decision had extreme challenges for people accessing abortion care, in part because of the very small number of clinics that were providing care during that time, all of which were independent providers. And because of the real efforts of their state legislatures to restrict and harm their constituents from being able to access this kind of care. So of that 15% of patients that traveled from out of Georgia to come get care in Atlanta, about 13% of that came from just those 3 states alone. So I think that that's important to note. All 3 of those states currently have total bans with no exceptions. And we are paying really close attention to how the laws continue to evolve in those parts of the country where there have been efforts to restrict travel and prevent people from being able to access care outside of the state. So we're working really closely with our council in order to make sure that we can provide the highest quality care for patients as possible. But I think it's important for folks to recognize that even though a 6-week ban is completely insufficient, it is not enough time for people to be able to put all of the preparations necessary in order to terminate a pregnancy. That does not stop people from even getting in a car, getting on a bus, getting on an airplane in order to make sure that they access that care. And so I think the tenacity of people who are in these situations know exactly what they want and need for their bodies and are acting upon it, and the robust network of people who are supporting people who seek and need abortions. Those are the things that we should be lauding and that we should act to protect in this time. As Nikki shared, things have a likelihood to get worse before they get better through a multitude of election results. And so it's important for us to continue to make sure that the networks that exist to make sure that abortion is available to people, even though they are complex, even though they are unfair, we must make sure that they remain in place until the point when we are able to fully restore abortion access in this country, which I absolutely believe will happen.
Thank you so much, Kwajalein. And again, thanks everybody for your thoughtful questions and engagement in the chat. We really appreciate it. And now I'm going to toss it over to Arthi for closing.
Thank you all so much for coming here today and for giving us your precious time. Independent clinics continue to be the primary providers in states with restrictive abortion laws and are showing us the path forward nationally. As we navigate an uncertain future, it is critical that we ensure clinics like Feminist Center continue to play this vital role. Consistent investment ensures we have access to healthcare while also fighting for a future with unfettered access. Following this call, we hope you'll continue to be in conversation with us. We need you in this fight to push forward. You can be involved by contacting us. I know that MK will be following out with a robust email with highlights from this conversation and next steps. Please be on the lookout for that and respond. If you are so moved, donate at the link in the chat and join us in this work that we are doing at the ground level to ensure that we all have access to care that is absolutely vital to our futures. Thank you so much for your time.
Thank you, everybody.
Thank you so much.
Thank you.